Good evening to everyone and welcome to today's session. Yesterday it was unfortunate that our server in the US was down and that made the transmission really problematic for a short while. Sometimes things happen. That's the reason it is called online. So only until it is on, it is in line. So let's make the start of the today's discussion of the yesterday's paper. We welcome Tirupati, Warangal, Kakinada, our online students, Dr. Anuja, all the way from Pune, and Dr. Swapna, Dr. Abhi, everybody. Now, doctor, the subscapular artery, it arises from the third part of the axillary artery and it contributes to the blood supply to the muscles which are nearer to the scapula. And the humerus is what need to be basically remembered. Now what is quadrangular space? This is a very standard question. The subscapularis and teres minor will be superior, teres major will be inferior, and medially by the long head of the triceps and laterally by the humerus are the typical boundaries of the quadrangular space is what need to be basically remembered. Is the voice clear? Did you check that? Okay. Now, you have abducted the arm to 90 degrees and then you have extended the flexed forearm against the resistance. What are we testing? We are basically testing the triceps brachii is what need to be remembered. What is required for flexion? We need biceps brachii, brachialis, which are innervated by C5, C6 root value, and the coracobrachialis, which is innervated by C5, C6, C7. These are the main flexors, and for all of them, what is common thing, doctor? It is the C6, which is the common thing, is what you need to remember. Generally, radial nerve is known to innervate all the muscles of the extensor compartment. But brachioradialis is the only flexor of the forearm which is innervated by the radial nerve is what need to be remembered. Now coming to the various nerves and the muscle that they innervate. So you need to know that the flexor policis longus is innervated by the anterior interosseous nerve, which is the branch of the median nerve, is what you have to ultimately remember. Now, if you take the anatomical snuff box, what is a very important structure which you can be able to feel pulsating in the floor of the anatomical snuff box, doctor? It is the radial artery, which can be felt in fact passing through the floor of the anatomical snuff box is what you need to remember. Another common question is, what constitutes this snuff box? Abductor policis longus, extensor policis brevis, and posteriorly tendon of the extensor policis longus. These are the ones which are considered to be the important boundaries. Now what is median nerve? What does it basically innervate? All our elbow joint innervation is basically from the median nerve. If you look at the lumbricals, first and second lumbricals are by the median, third and fourth lumbricals are by the deep branch of the ulnar nerve. First and second means towards your thumb, third and fourth is towards the little finger, ulnar border. Hence ulnar nerve is the one which basically innervates them. In addition to that, what are the various muscles innervated by the median nerve, doctor? Prunita pteris, flexor carpi radialis, palmaris longus, flexor digitorum superficialis. Even the rarest of the rare dreams, we never had a plan of reading this much anatomy. But now every nerve, every muscle are going to come to your help in tomorrow's exam. Now, How does ulnar nerve basically innervate? It innervates the flexor carpi ulnaris, it innervates the elbow, it innervates adductor policis. But if you look at the lateral part of the palm and the dorsum of the hand, what is their main innervation? It is the they are not innervated basically by the ulnar nerve is what you have to basically remember. If you look at the ulnar nerve, its palmar cutaneous branch innervates the skin on the medial part of the palm, not the lateral part of the palm. And the dorsal cutaneous branch of the ulnar nerve innervates the dorsal aspect of, once more, medial part of the hand, not the lateral part of the hand. That's what we have to ultimately remember. Once the brain is herniating through the tentorium, then tentorial notch, that's right, as rightly mentioned by our online student Anuja and Swapna, it is the radial nerve which need to be remembered for the lateral aspect. Now, herniation of the brain through the tentorial notch. What is the most important structure? When there is a raised ICT, the midbrain will give rise to third and fourth cranial nerves. So, oculomotor nerve is the one which is typically compressed. Shoot me an answer, doctor. One bold answer to me. Schiller dual bodies which resemble glomeruli. They are typically seen in which ovarian tumor? Who is going to give me a confident answer? Schiller dual bodies. Where do you see, doctor? That's right. Our Anantapur and Warangal students have rightly answered. It is the York sac tumor, otherwise called endodermal sinus tumor, is the one which will be responsible. At the level of the superior colliculus, if you take the transverse section in the midbrain, see there are four colliculi, two superior colliculi, two inferior colliculi. The red nucleus, substantia nigra, Edinger Westphal, they are all at superior colliculus, whereas the trochlear nucleus is typically located at the level of the inferior colliculus, is what you have to basically remember. Now, where is the Broca's area typically located? Broca's is in the dominant hemisphere and it leads to development of expressive aphasia, is what I want to underscore to all of you. What is the role of superior cervical ganglion? From the hypothalamus, sympathetic innervation will pass down and it will reach the superior cervical ganglia, which is the sympathetic ganglion, where postganglionic sympathetic fibers will be passing to the entire head, is what you have to ultimately remember. Now, coming to the dorsal columns. Where will the dorsal columns ultimately reach to the thalamus and which nucleus will they innervate? Ventro-posterior, the medial lemniscus will ascend and it will ultimately synapse the ventro-posterior lateral nucleus, not the ventro-posterior median nucleus, is what you have to ultimately remember. Now, some patients of syringomyelia, they develop the atrophy of the small muscles. Typically, why does atrophy occur? Whenever Andrehorn cells get affected. Hence, in syringomyelia, when the cavitation increases, the ventral horn neurons will get affected and that will lead to the atrophy of the small muscles of the hand, is what we need to remember. Now, shoot me an answer, doctor. As much you have disappointed yesterday, I was also disappointed, because after taking 3 hours of test, like a laboring woman, we love to see the parturition and the baby's cry. If the baby's cry is postponed to next day, it is definitely a obstructed labor. But anyway, give me one confident answer, doctor. Excellent. We get one answer already from Dr. Shweta and Varangal, who agree that it is granulosa tumor. Do you also like to say the same? Benign unilateral, looks like a bladder, encapsulated, coffee bean nuclei. I have not yet get the answer. Anybody confidently? Granulosa is one proposal. Brenner is benign, B for benign, B for bladder like, B for bean like, coffee bean like nucleus is the Brenner's tumor. That's right, Dr. Anuja has rightly answered from Pune, Brenner's tumor. Now if there is an atrophy of the lingual muscles, obviously it is a hypoglossal nucleus which is implicated, no big deal. Now, pons may, what are the nuclei located? 5th, 6th, 7th. And the descending pyramidal tract fibers are also located in the pons. Not the hypoglossal. Hypoglossal is located in the medulla. 8th, 9th, 10th, they are all located in the medulla. Now the internal carotid, it is the middle cerebral artery which provides most of the blood supply to the lateral aspect of the frontal and the parietal lobes, is what you have to ultimately remember. What is internal capsule? What is the blood supply of internal capsule? Very important question. Tomorrow a good number of you are going to become neurologists, practicing neurologists, radiologists, in addition to be good neuroanatomists. So tell me, doctor, the lateral striate, anterior choroidal, central branches of the middle cerebral, they all contribute to the internal capsule. What is the importance of internal capsule? All the efferents which are going to ultimately supply our motor muscles, they pass through internal capsule, hence we get hemiplegia. But not the posterior cerebral. Posterior cerebral doesn't contribute to the blood supply of the internal capsule, is what need to be remembered.